while reducing red meat and sugar foods and beverages. Try getting more active. Enjoy at least 150 minutes per week of moderate activity or 75 minutes of vigorous activities spread throughout the week to help manage cholesterol. Finally, always remember to talk with your own medical provider to discuss the best plan of action for your health.
Good evening, everyone, and welcome. This event is being brought to you by Mount Olive Baptist Church in Centerville, Virginia, by a program that was funded by Potomac Health Foundation, HEART, helping everyone access resources for total heart health. So tonight we will start with discussing cholesterol. And so the topic tonight is heart to heart. What is cholesterol telling you? In our agenda, we will now have Sister Misha Adams open us up in scripture.
Thank you, Dr. Charmaine McCoy. I'll be reading from Ephesians 4, chapter, verses 15 through 16, the New International Version, and it reads as such. Instead, speaking the truth in love, we will grow to become in every respect the mature body of Him who is the head, that is Christ. From Him, the whole body, joined and held together by every supporting ligament, grows and builds itself up in love as each part does its work. May God add a blessing to the reading and hearing of His word.
Amen. All right, let us bow. Heavenly Father, we come before you with hearts full of gratitude, thanking you for everyone gathered on this call. As the landscape around us continues to change, we are reminded that the blood still works, covering, protecting, and sustaining us each day. Lord, we ask that you continue to keep us healthy, physically, emotionally, and spiritually. Grant us your wisdom, knowledge, and discernment in every decision we make and every step we take. Help us to find strength in community and connection, to lift one another up, and to move forward in unity and love. We speak blessings over every person on this call, over their home, their work, their purpose, and their peace. In Jesus' name we pray. Amen. All right, so I'm really excited about tonight. So a few housekeeping rules. We have everyone on mute, but the chat feature is active. So please actively engage with us as we go through the webinar. So we want this as interactive. And thank you for anyone that was on our first call. Thank you for joining us again tonight. So just briefly, the Heart team, as I said, we do have a grant that we are addressing food insecurity as well as undiagnosed high blood pressure. But really the foundation for everything is for us to start with just understanding around cardiovascular health. So we're just trying to increase the health literacy in our communication, in our community, So our heart program team, Reverend Dr. Brenda McBurrow, who is the Director of Community Outreach and Engagement at Mount Olive. Then myself, Dr. Charmaine McCoy, Director of Health and Wellness. We also have Dr. Faith Elise Metlock. She's our Nurse and Research Scientist. Vanessa Alvarez, our Clinical Research Specialist. Alex Pinnell, our Clinical Research Specialist. Look at me, I'm upgrading you, Alex. I love it. And then Anna Baez-Matea, who is also our Clinical Research Specialist. So this makes up the team. And we have been out in the community. We have partnered with 4 faith-based organizations in the Prince William area. We've been out to Mount Zion and Triangle, as well as Little Union and Dumfries. So very excited to continue to do the outreach and just continue to uplift the community. So now we will move into the webinar. And I will allow our wonderful speaker, Dr. B. Naragu, to introduce himself and get this started.
Hi, everyone. That was a very wonderful introduction by Dr. McCoy. Thanks for having me. My name is Dr. B. Naragu. currently a fellow. I work with Dr. McCoy and Faith in Eindhoven here. I've worked for a bunch of years, 11 years with experience in cardiovascular disease. I currently work as a cardiovascular disease prevention fellow. Like I mentioned earlier, here in Eindhoven at Sheerhead and Vascular. Been a member of the American Heart Association, American Society of Preventive Cardiology. For as far back as 2019, I've also been opportunity to serve as the co-chair of the American College of Cardiology Resident Leadership Group. I do like to play tennis, and I do like to bike, and I also like enjoying time spending time with my family. So without further ado, we're going to talk today about cholesterol. Um, Cholesterol, we know, has been a marker of heart disease, and we're going to talk to a lot about cholesterol to let us, to let everyone know what cholesterol is, the different types of cholesterol, and how cholesterol impacts our well-being as a human. All right, so moving forward, cholesterol, like we know, is pretty much essential for the good health of the mind and body. But sometimes too much of cholesterol can become a problem. Cholesterol is good to build cells, also hormones. But when it becomes too much, becomes a problem, and it can predispose to risk of heart disease and heart attacks. And it's also important for us to every now and then to get checked for our cholesterol numbers, because knowing your numbers, when you know your numbers, you can actually do better. Um, higher cholesterol level has been shown to be linked to heart disease, heart attacks, and stroke. And we're going to talk more about ways to improve your cholesterol, ways what to be on the lookout for, and in the upcoming slides. So quickly, cholesterol is a fat-like substance that comes from two sources. It comes from your food that you eat, and also from our body. Our body has a way of making cholesterol. As a matter of fact, the cells we have in our body is being made of both proteins and fats, which are also cholesterol. Mostly from food is being shown to come from animal sources. And then when you eat food, like when you eat anything that has fats or cholesterol, it gets absorbed in your body from your intestines, your stomach. It gets absorbed into the body, and it's gets absorbed as a lipoprotein. Like LDL, it has a low density lipoprotein, and HDL, the high density lipoprotein. And it goes to your liver, and your liver like synthesizes, like it breaks it down. It forms all forms of lipoproteins, and then it gets reabsorbed into the bloodstream. And then, again, looking at the slide, you can see here is a fat-like substance in your blood. When it becomes too much, those fat-like substance can actually clog up your blood vessel. Think about like a pipe. The blood vessel as a pipe, and then when cholesterol builds up on the high cholesterol level builds up on your artery, like kind of like clogs it up, and you can see the screen here. You could see this yellow junk here. These are all cholesterol plaques. Now, when it builds up on your blood vessel, it it obstructs the flow of blood to your heart, to your brain, and this can eventually lead to heart attacks or stroke. So knowing your cholesterol numbers is highly essential for people like us, for humans, and especially for Hispanics and Blacks, because high cholesterol numbers has disproportionately affected um, this population. Next slide, please. So, I did talk about the HDL, which for short, which means the high density lipoprotein, and the LDL, which is also the low density lipoprotein. Now, the way I want you guys to think about it is the HDL, that's a high density lipoprotein, is the good cholesterol, while the LDL is the bad cholesterol. So I'm going to talk more about the HDL, which is the good cholesterol, first before we go down to the LDL. Now, the HDL, for the most part, has been shown in most studies to be linked to improved cardiovascular outcomes like lower risk of stroke, lower risk of heart attacks, and lower risk of other heart conditions. Pretty much, you can raise your HDL by exercise, like staying very active. What would you recommend from the American Heart Association is at least 150 minutes per week of moderate intensity exercise, which means exercise that can make you sweat. Some get it divided into like 30 minutes 5 times a week. So normal levels, anything above 40 of HDL becomes normal. So we do want, high density lipoprotein, that's HDL. We do recommend to get your numbers above 40, which is like the cutoff for, for higher, for better numbers. Now the LDL, which is a low density lipoprotein, what we call the bad kind of cholesterol, Now, this is a cholesterol. This is a type of cholesterol that has been linked to poor cardiovascular outcomes, including strokes, heart attacks, and other even peripheral arterial disease. Sometimes you see like you have poor circulation when you're trying to walk. You don't feel you feel like lots of aches on your calves or your legs. So these are all signs of cholesterol buildup on the low on the blood vessel of the lower extremities. But most importantly, is the is its causative factor in heart attacks and stroke, because these are all like very life altering diseases, right? So LDL is a bad cholesterol. Mostly, like we mentioned in the previous slide, we could get this high LDL numbers from from diet, mostly from diet, like consumption of like animal food, food rich in fats, food rich in processed food, also like being overweight, is all linked to high LDL again, which is the bad type of cholesterol. And then we're going to talk more about it in the next slide. But I'm just looking at this slide here. You could see here that think about it, HDL as a good cholesterol, which can reduce the risk of heart disease. So when it goes into your blood vessel, it kind of like has a way of mopping up other kinds of bad cholesterol for the most part. Compared to the bad cholesterol, which is the LDL, you can see this yellow plaques here, which are called junks. Now, when when LDL builds up in your blood vessel, it all like adds up, and when it adds up, it kind of like forms all these junks in the blood vessel, and then this plaques eventually goes on to obstruct the flow of blood in your blood vessel, which can lead to stroke or heart attacks. Now, the good thing about this is if you know your numbers early, you can change your lifestyle. You can modify your lifestyle to lower your LDL level. Because over time, imagine having high LDL levels for the years, for years, decades. When all this adds up, it kind of like impacts your risk over time. Like you start having high LDL levels from say age 20 or 30. By the time you're 60s or 50s, you're already setting yourself up for maybe heart attacks or stroke. So the aim of this lecture is to talk more about it, so we can actually know better about this, about cholesterol, and how to modify our risk and how to improve our cholesterol numbers. Next slide, please. So the next question will be, do we know our cholesterol numbers? When was the last time you had your cholesterol checked? And I'm gonna have everyone put up in the chat, when was the last time you had your cholesterol checked, or do you know, yes or no? But again, this can like to think about think about this as, what am I doing to reduce my risk of having a heart attack or stroke? Again, we do see patients in the clinic sometimes, and for the most part, they don't really know about the numbers, or maybe they were told sometime in the past, but they didn't get a chance to have a frequent, have a follow-up checkup about their cholesterol numbers. And the high cholesterol, we know it can be treated. We do treat these numbers, and we can drive it down to a very reasonable level to to reduce your risk of heart attack or stroke. So again, think about this: do we know our cholesterol numbers? Is it time to get it checked? Is it time to get it next checked? For the most part, we do recommend for younger people, younger folks who are younger, we do recommend at least once every year. But when you become much older and your cholesterol numbers become high, we want to check at least more frequently, maybe every 3 to 6 months for the most part. So again, think about this. Am I doing everything within my reach to get to know my cholesterol numbers, which eventually will impact your risk of heart disease or stroke? Next slide, please. Good. So what are the causes of high cholesterol? Again, high cholesterol, we really want to focus more on the bad cholesterol, which is pretty much what impacts our risk of heart disease or stroke. So the first on the list here is being overweight. Now we do know, being overweight, which I will describe as a BMI above 25. So BMI 25 and above, up to like 29.9, is overweight. Now when your BMI crosses above 30, it becomes obese. Now, being overweight increases your risk of having the bad cholesterol, the bad type of cholesterol, which is LDL cholesterol. Also, being inactive, exercising, like we did talk about, being active, like going to the gym, working out, taking walks, whatever you can do to stay active. Again, 150 minutes of moderate intensity exercise is what the American Heart Association have recommended, to mitigate the risk of heart disease and also to lower your cholesterol numbers. Um, of course, family history also plays a huge and significant role. Now, if I mean, every now and then we do see patients who have a family history of cholesterol, and for the most part, this patients, you see them having what we call premature coronary artery disease. Sometimes you see them having, have a family history of heart attacks in your father or mother at a very early age, like around age 40s or age 50s. Now, when you see such a patient or when you see such a person, you wanna ask them, have you ever had your cholesterol numbers checked? Because think about this, having cholesterol build up from a very young age, like from age 5, early on up until your 40s, and what we're talking about, like very high levels of of the bad cholesterol, and when this builds up for a very long time, from early onset for a long time, it can predispose you to having like heart attacks, strokes at a very early age. So when we see patients will come in with family history of heart attacks, say at age 40s or 50s, we think about family genetic causes of high LDL level. I want to get them checked. And for these people, we do start them on cholesterol or lowering medications way early on, as low as age 15, 12. So again, you don't think about family history when you see such kind of history. And then poor diet, which is one of the most popular cause of high LDL cholesterol. Now think about what you eat. Like, are you eating like processed food? Are you eating lots of fried food? Are you eating lots of starchy foods? Again, all these can actually impact your risk. Can actually add to you having high LDL cholesterol. So we do recommend eating more healthy, eating like fruits and vegetables, um, avoiding the fatty foods, avoiding also like sodas, processed food, pretty much staying more natural. Dr. McCoy would describe as the more colors you have on your plate, the more healthy it looks like. So I do agree with that because when you eat lots of fruits and vegetables, think about the different colors of fruits and vegetables. The more colors you have on your plate, the more healthy you should, your diet is. So again, overweight, being overweight, which means a BMI of 25 and above, also being obese as well, 30, BMI of 30 and above, being inactive. We do recommend staying very active, working out, taking walks, whatever you can do, at least 150 minutes of moderate intensity exercise can help drive down your LDL numbers. Family history as well, like we mentioned, when you know someone or you see someone who has a family history of early heart attacks, what we call premature coronary artery disease, is a signal to take a deeper dive into their cholesterol levels. And then poor diet is the most common cause of high LDL cholesterol level. Next slide. So what are the consequences of high cholesterol? And then we mentioned this earlier, but again, high cholesterol has been linked to poor cardiovascular outcomes, and we know that cardiovascular disease is the most common cause. It is the number one killer of men and women worldwide and in the United States. So again, high cholesterol can impact your risk of having a heart attack. It can also impact the risk of having stroke. It also impacts the risk of having like peripheral arterial disease or what we call poor circulation. It can also um, impact what we call, it can also impact what we call the metabolic syndrome, which means a constellation of high cholesterol level, being obese, hypertension, diabetes. So for the most part, all this kind of like work together. Mostly when we see someone who has a high cholesterol level, most of the time they're either overweight or obese, or they may have other comorbid conditions like hypertension or diabetes. And then when you have all these factors together, playing out together, they do drive remarkably your risk of having a heart attack or stroke. Um, so, like we mentioned earlier, so high cholesterol leads to a buildup of plaques in the arteries. So, when you look at this artery here, you can see. So, this guy here has had cholesterol for I mean, I guess years or decades, and you can see how it all clogs up the artery here, preventing the flow of blood to the brain or to the heart or wherever it supplies. Then to my left is a normal artery without cholesterol plaque. So this the guy on this other side has normal cholesterol level, and you can see how you know how well the blood vessel look, how clean and healthy it looks like. There are no obstruction to the flow of blood. There's really nothing preventing the flow of blood again. And to the right side, when you see this cholesterol blocked artery, what it does is what we call, it forms a plaque. So with the cholesterol, calcium goes to deposit on this cholesterol, causing plaques. Now, when this plaque, which means cholesterol plus calcium, when this plaque ruptures, it can also go further to block the flow of blood. So not just it's narrowing the artery, it also could rupture. It could rupture, and when it ruptures, it goes down to block, blood supply to the heart or to the brain somewhere further down, and this can all impact the risk of stroke or heart attacks, or even kidney disease or other forms of chronic diseases that we know. So we talked about cardiovascular disease here. We talked about stroke. So when high cholesterol builds up on the blood vessel supplying the brain, it can block a critical path to your brain by clogging up your arteries. Think about it like a pipe, So a pipe there supplies water somewhere else, and when the pipe gets blocked, of course, water can't really flow. You have to get a plumber to go open up to go clean up the pipe, right? So that's what we do in the hospital when a patient comes with a heart attack. They do have cholesterol build up. We call an interventional cardiologist will, will sometimes can look like a plumber. They go in and open up the blood vessel to the heart, and that way the blood can easily flow back again into the heart, supplying the muscles, supplying the brain, and just that's similar. That's the way we, as an analogy to high cholesterol. I mean, using the pipe and the plumber for as an example. Diabetes. So diabetes can also put a dent in your good cholesterol and increase your bad cholesterol. So folks who are diabetic as well, um, diabetes on its own as a disease can impact your risk of high cholesterol. Again, diabetes we know can be genetic, can also be from diet. So they all go hand in hand. Like if you're consuming poor diet, right, you can also raise your high raise your bad cholesterol, and with your poor diet that can lead to risk of diabetes. It can also lead to a risk of high cholesterol. And when you have diabetes and cholesterol, but on high cholesterol, this can all impact your risk of heart attacks and stroke. Um, and then the last one is a peripheral arterial disease, or what I call poor circulation. So think about it this way: similar mechanism, having the cholesterol going to build up, the bad cholesterol, sorry, going to build up on the blood vessel supplying your extremities, that's your lower extremities, your legs. So when this goes to block the flow of blood in your legs, or your calves, or your legs for the most part, when you're walking, your leg muscle should be able to receive a certain number of oxygen, correct, from the blood supply. Now, when the cholesterol has gone to block this blood vessel or to narrow down this blood vessel, your leg muscles are not really getting enough oxygen to make them function well. And in that way, you feel the pain because they're not getting enough oxygen because they have lower blood supply due to cholesterol build up within this blood vessel. So these are all this, the side effects or the consequences of high cholesterol. And again, it's something we need to think about, like, what are we eating? Are we eating more healthy? Are we staying more active? Do we have a family history of early heart attacks or early stroke? We want to think about it. Ask your doctor, hey doctor, I had this history of premature coronary artery disease. I had a grandfather, uncle who passed away from a stroke or heart attack at a young age. Maybe you want to help me check my cholesterol, or this can also prompt us here, like, okay, let's go check out cholesterol. So I think it's highly important. This slide is very important that we know, the consequences of high cholesterol numbers. Next slide, please. So what can you do to improve your cholesterol numbers? So number one here on the list is, of course, eat a heart healthy diet. Now, what is a heart healthy diet? Again, we mentioned earlier that eating a diet that's rich in fruits and vegetables. Again, the more colors you have on your plate, we do think the better or the more healthy your diet is. Clean up your food, avoid the junk food, avoid, if you can eat out as low as, I mean, as less frequent as possible. That'll be helpful because when you cook your own food, you do know the content of your food. You know the amount of cholesterol you have. I mean, the amount of fat you have in your food, the amount of salt you have in your food, and that way you can, for the most part, decide how healthy you want to eat. So again, eat more healthy, eat more healthy diet. What we call Mediterranean diet, which is a diet rich in fruits, vegetables, nuts, and all those kind of healthy foods. And again, avoid the bad food, the processed food, the fried food, avoiding sodas, avoiding chips. Again, these are all like what I call the bad food, which can, in one way or the other, raise your cholesterol numbers and also impact your risk of having not just high cholesterol, but also other risk factors like hypertension due to high sodium content, or even like worsen your risk of being overweight, like we all know, or obese, also impact your risk of having diabetes. Now, staying very active, regular exercise, and then again, we do something I want to mention, very frequently. Whatever you can do will be wonderful. Like for me, sometimes, like if I can't really exercise at home, sometimes I do take the stairs to my office. I walk on the seventh floor here, in my office. But again, I do try to take as much, I try to stay active as much as I can in every little work, and I can. I take advantage of every little thing I can. You want to like walk maybe 1 mile, you can just like walk a mile than driving for the most part. So staying active, we do recommend 150 minutes of moderate intensity exercise, at least 150 minutes of one moderate intensity exercise per week. Now, some folks will divide this across the week, maybe 30 minutes, um, 5 days a week, and that way you can, in one way, you can sort of, for the most part, drive down not just your risk, not just your high cholesterol, but your overall risk of cardiovascular disease. Um, Lose weight. Again, the normal BMI here is 25, and for those who don't know, BMI is calculated from your height over your weight. So you just check your height. So you check you check your weight over your height. So um, BMI of 25 and above means overweight. 25 to 29.9 means you're overweight. But then BMI 30 and above means you're actually obese. So again, lose weight, the lower the better. Lose weight, stay active, lose weight, try and get your BMI into like lower than 25, and that way you can drive down your LDL cholesterol. Okay, don't smoke. Again, smoking is also another risk factor. I know smoking is something that we see every now and then, but again, smoking does similar thing to what cholesterol does to your artery. What smoking does, there are lots of toxins in a cigarette, right? So those smoke, when you inhale them, they wouldn't cause buildup of cholesterol, but they go to cause inflammation on the blood vessel, on the inner lining of your blood vessel. So think about, like, when you look at a blood vessel, so you should have lots of inflammation inside your blood vessel. And when those happen, mimic um, um you can mimic just you can mimic the way you have high cholesterol on your body. So smoking is not good. When you're smoking and you have high cholesterol, they all adds up to your risk of having heart attack or stroke. Then stay on top of your risk factors. Are you hypertensive? Check your blood pressure at least once daily. Ensure you're taking your blood pressure medications. Your blood pressure should be within goal, at least less than 140 over 90 for some, or 130 over 80 for others. Are you checking your cholesterol as well? See your doctor, ask for cholesterol numbers, get checked all the time. Are you diabetic? Make sure you take your diabetes medication. Check your A1C every now and then. Check your blood glucose as recommended by your physician. Um, are you sleeping well? We do recommend sleeping fine, like 7 to 9 hours of sleep, because we know when you don't sleep well, it kind of raises your cortisol and raises your other. It has a way of they're all interconnected. When you don't sleep well, you're more likely to eat unhealthy, and when you eat unhealthy, you're more likely to have high cholesterol. You're more likely to become overweight. You're more likely to have hypertension. So all of these actually are all intertwined. So again, when you think about all these risk factors, I think it's great to have all this in mind, when we move forward with our lives. So what are the HDL raising food? So HDL is a high density lipoprotein, and this is the good cholesterol in quotes. So foods like olive oil has been shown to raise HDL cholesterol, avocados and walnuts. But I want to put a caveat: olive oil is good, but again, it has lots of calories, as we all know. But again, olive oil, at least 1 to 2 teaspoons of olive oil per day, it's recommended, and this has been shown to raise your HDL. And also staying active when you exercise as well. It can, for the most part, raise your high density lipoprotein, which is the good cholesterol. Now, what are the things that can raise your LDL? Again, we talked about this earlier on, like egg yolks, fatty meals, shellfish, full fat dairy products, and processed snacks. You see all the snacks, lying littering here and there. Again, when you think about all this, um, these all can also raise your LDL. And I have a mentor will attribute. So he calls most of these processed snacks edible cigarettes, in a sense they're like, when you look at them, they're not cigarettes, but actually they're, you eat them, but they have similar effects, very lethal and bad effects as what cigarette does. I mean, as a cigarette. So think about all of this when we're making our life choices. And then there are things that can lower your LDL and triglyceride levels, like oatmeal, apples, oranges, salmon, tofu's. These are all food that can drive down your LDL and triglyceride levels. Again, triglyceride is also, we didn't talk about it earlier, but triglyceride has been shown to be a marker of heart disease. It's been shown to be high among those who are obese and those who consume very poor diet. When I mean poor diet, like processed food, dairy foods, fatty foods and fried foods. Again, other
And
things that could raise your triglyceride levels are when you drink excessively, like drinking lots and lots of drinks. It doesn't matter what kind of drink you drink. You could drink beer, you could drink spirit, you could drink wine, whatever. But again, drinking lots of this excessive drinking that can actually raise your triglyceride level. Simple carbs like rice, potatoes, pizzas can also, I mean, eating them persistently on a very high level can also raise your triglyceride level. Sugars, animal products. So again, this is all like telling us, like, should be very, very selective of what we put into our mouths. We want to make sure we're not putting into our mouths edible cigarettes for the most part. Next slide, please.
then quickly, Dr. B, just monitoring the chat. Any suggestions of what to eat when dining out?
Okay. Well, I mean, yeah, I mean, Shamina, Dr. McCarr, I'll probably need your help as well. But again, for the most, I'm going to start with drinking. We do recommend for men, what American Heart Association has recommended when you go out to eat, or for the, not just when you go out, but just your daily consumption. For men, not more than 2 drinks per day, and no more than 2 drinks per day. So maximum of at least 14 per day. This is what is recommended for men. Then for women, not more than 1 drink per day. If you ask me the difference, why is different between men and women, I'm not sure. But that's what is recommended for both men and women for drinks. In terms of food, again, when you want to go out to eat, I think overall, think about it this way: like whatever you put into your mouth will, in one way or the other, affect you. Are you making the right decisions for yourself? Right. Again, it's okay to give yourself a treat every now and, I mean, once in a while, but you don't want to like do that like very frequently, because whatever you're doing will eventually affect your risk of heart disease. So I'll say, eat healthy. Think about, like, always try and get a salad on your plate for the most part if you can. The more colors you have on your plate, the better I think it is for you. Stay away from fatty foods. Stay away from, I'm not gonna say stay away from carbs, but again, if you can, limit your carbs or start your foods, that'll be fine. Eat more of fruits, vegetables, avocados. Um, yeah, again, I mean, there are lots of different kind of cuisines, but I don't know, Dr. McCoy, if you want to jump into to add on to this as well.
Yeah, and I think, when we think about going out, of course, it's probably usually for a celebration and stuff. So, still trying to look for items on the menu, once again, that aren't overly processed. So, you don't want something that's deep fried. Don't necessarily need a lot of stuff that's smothered and covered, especially if the smothering is batter, cheese, things like that. Definitely when choosing your sides for like entrees, opt for broccoli, kale, low carb type things. And then another rule of thumb too, even with the portions that you receive when you go out to eat, maybe like from the onset, just dividing half of the meal and only consuming half while you're there and taking the rest for leftovers.
Excellent. Thank you, Dr. McCoy.
Oh, and then we got one that just popped on the screen. Can eating healthy unclog your arteries?
Well, that's an excellent question. And then again, so well, that's a good step in the right direction, correct? Yes. So eating healthy wouldn't, for the most part, unclog your artery. It's only going to prevent further clogging of the artery for the most part, right? Now, the good thing is, if you're young, so there are less chances that your artery must have been clogged up, right? But if you're older and you've had higher levels of cholesterol for a long time, like years and decades, there are very high chances your artery must have been clogged up by bad cholesterol. Now, but what we recommend, the first step is to change your diet, right? If you change your diet, what it means is you're preventing future clogging from happening, so which is a good step in the right direction. Now, the next step would be to offer you some medications that can help, lower your cholesterol levels to the lowest. I mean, to the level that's appropriate for you. So, to answer the question, well, it wouldn't help to unclog, but it's going to help prevent further clogging, which is, I think, it's the first step in the right direction. And then there are other treatment, other medications, other interventions that can help to unclog those arteries. Like there are interventions like you can do it, they could be CAD, there could be other things that could be done. Medications can help clean them up. But again, I think changing your diet is the first step in the right direction. I hope that answers the question.
Excellent. All right. So now we have a let's chat. So one lifestyle change you or your family could try this week. And then I'll jump into all that you have told us tonight about the recommendations for 150 minutes of moderate intensity exercise per week. So definitely something that you can engage with your family, walking in your neighborhood, going to a park, things like that. All right. Any other suggestions in the chat before we move on? All right, let's keep this train rolling. Oh, wait, I got one. Is there something available to assist with cleaning the arteries along with a healthy diet?
Well, yes, I don't think I did mention about the medication. So yes, Michael Freeman. So yes, there are a bunch of medications out there that we know what they do. They tend to stabilize, the plaque. They call them stabilization of the plaque. So the statins, right? There are a bunch of statins medications out there, and this medication has been shown remarkably to what it does. It drives down your level of the bad cholesterol in your body. It goes into your body. It mops up those bad cholesterol, like it mops them up, and your body is able to excrete them very easily. So your LDL level, which is the bad cholesterol level, goes down to acceptable limits. That's one. And if you already have a plaque, you already have this clogging occurring already, what it does is goes to like stabilize them. So when it stabilizes them, it prevents them from rupturing. Again, like I mentioned earlier, when this plaque rupture, or what I call the clog, when it ruptures, it can go further down to obstruct the blood flow, which can cause a heart attack or stroke, right? Now, when you take this medication, it stabilizes those plaque or those clog, and it converts them from a soft plaque to a hard plaque. Heart may seem a little bit not nice, but the heart plaque means is stable and it's not able to rupture to cause further damage elsewhere. So this has been shown to drive remarkably the risk of heart disease or heart attacks and stroke in patients now. And we see lots of patients taking this medication. And as a matter of fact, we've had some patients who've had a heart attack and they did not require an intervention, but they were able to take this medication and their symptoms got better. So yes, there are medications out there, and if you have high cholesterol level, speak to your doctor. Definitely, they can offer you some medications that can help drive down these numbers. That's right, Karen. But yes, let's just take Sarah. Awesome. Okay, so yes, so just gonna like this. So this slide here talks more about what we can do to lower our blood pressure and our LDL, which is bad cholesterol. And I'm gonna start with the bad things, right? And someone did ask the question what to avoid when we go out to eat. When we go out to eat. So to my right is the food we want to limit. So you can see all the fatty foods here, right? The bacon, the cheese, and all of that. So try and stay out of them. Full fat dairy, sweetened sugar, beverages, sweets. So this sodium intake as well. What we recommend for sodium is 1500 to 2300 grams of sodium per day. And I think about it this way, cooking your food at home, you're adding some table salt to your food. That's fine. But when you go out, you don't really know how much salt they've put into the food you're eating, right? And also, you're buying this processed food out there that has lots of sodium. So always look at a pack, the content of the food you're eating to see how much sodium it has. sometimes they say 10% DV, which means daily value. So if you're eating 10% of your sodium in one snack, means you've already eaten like 10% of what you should have eaten in a day. So think about other things you should consume when you go home as well. You may eat like 50%. Then when you get to 100%, that means you've had enough sodium for the day. So these are all things to like put into cognizant when we're buying food, or when we're like making our, our dietary decisions. Avoid sweets, avoid sweetened beverages, avoid fatty foods, and these are all things we want to limit as much as we can. Now to my left, these are like the nice things, or the things we do recommend to eat. Eat lots and lots of fruits and vegetables. And again, the more colors you have on your plate, we think the healthier those foods are. Now, whole grains, eat more of whole grains, legumes is all like nice, nuts and seeds, very good. Vegetable oils, olive oil is what we do recommend. Olive oil has been shown to raise HDL. Eat beans, eat poultry, fish, pretty much white, lean meat as well has been shown to be helpful as well. And whole grains again. So when you think about it this way, the right means the bad stuffs, and then the left means like what would you recommend eating lots and lots and lots of them. So again, so pretty much slash seems a little bit tiny, but again, these are all like fruits would you recommend to would you recommend to consume, like blue purple, the blackberries, the plums, the blueberries, the black carrots, the dates, the eggplants, the grapes. So again, so you could just take a look at this plate to see how colorful it looks like. You can see the purple, you can see the pink, the red, the beets, the cherries, pomegranates. You can see the pink. So there are lots and lots of colors. Then to my lower left is the green. You see the asparagus, the broccoli. You can see all of there. And then to my, to my lower right is like, fruit like orange and or, sorry, oranges, and every other like kinds of food. And then lower down you have bananas, mushrooms, onions, cauliflowers. Again, we think there are, the more colors you have on your plate, the better. And you consider the family eating lots and lots of fruits. So this is what we recommend, if possible, to to consume. Make your plates as much colorful as you can, for the most part. So
All
let's
right.
chat. So I mean, I know we've talked about a lot. We've given lots and lots of information. But what would be your favorite color, fruit or vegetable?
All right, I'll go. I'll go with blueberries. Great antioxidants. And then we did have two questions that came up in the chat. It says, how long will it take to lower cholesterol numbers just by changing your diet?
Well, that's an excellent question. Again, so Lisa Chains, well, that's a very great question. So the way I think about it this way, excuse me. So normal cholesterol, well, what would you recommend if you're a young healthy person? The what would you recommend for cholesterol numbers is anything less than 100, so 99 and below is okay. This is the LDL cholesterol, the bad cholesterol. Now, how long would that take you to? How long would you lower your cholesterol number? Depends on where you're coming from, right? Now, if you're coming from LDL cholesterol of 200, diet alone wouldn't drive you down to 100 or to 99. That we know for sure. So definitely you need a medication. But if you're coming from 120 LDL, um, again, we know when you change your diet in a bunch of 2 or 3, 4 months, you can actually get it down to somewhere less than 100. But again, it all depends on where you're coming from in terms of your LDL numbers, and also how much of how long you've changed your diet. You don't expect to change your diet, to change your diet in 1 month, and your LDL cannot go below, from 200 to 100. It's going to take a whole long time. But we know for these patients, they do need some help with medications for the most part. So again, this depends on where you're coming from, and also how much you've changed your diet. So I'll say if your cholesterol is borderline high, overall, when you change your diet remarkably, we could see the changes in the next 3 to 6 months. Um, but if your cholesterol is super high, then that may take way longer. You perhaps may need some medications to help with that.
So the next question, we're actually going to hold this until you talk about the prescription medications, and then if you don't address the muscle aches in that, then we'll jump back in and do that one. So hold tight, Minister Leonard.
Good. Okay. All right. So yeah. So this slide pretty much talks about the medication, and I know I did like talked about briefly about the statins, which is a medication that we prescribe to help lower this medication, right? So so statins we know is a first line medication for cholesterol lowering in adults. It's very common. It's been on for decades, I think 3 decades or so, if I'm correct, and it's been shown to lower your to drive your cholesterol levels down. And not just that, it's been shown to lower the risk of heart attacks and stroke. As a matter of fact, we think is a wonder drug in the area of preventive cardiology. So again, it's been amazing. It's been shown to have like lots and lots of benefits to those who have those who have high cholesterol, and it has also driven down the levels of heart attacks and stroke we've seen among the older population in the U.S. And all over the world. So so what it does, it does actually lower the bad cholesterol, LDL cholesterol. And we know this medication, for the most part, when you start this medication, it drives down your cholesterol, your bad cholesterol, your LDL, by at least 50%, by half. So say you're coming from 120, you take this, start taking this medication, and you repeat your labs, you expect to see your numbers go down to 60. If you're coming from 200, would you expect this to go down to like your LDL to go down to like 100? But however, the most common side effect is muscle pain. It's very, very well, it's a common side effect. Um, However, when you do, if patients come to see me and they have muscle cramps or pain, again, we do switch them from whatever they're taking to a different. Again, there are multiple statins. You have the atorvastatin here. You have the rosuvastatin. You have the simvastatin. You have the There are there are a bunch of them. So say you run atorvastatin, which is the first one here, and you don't tolerate, you have lots and lots of muscle pain, we can switch it to the rosuvastatin, which is the next one right here, the Crestor, right? And again, you have the same side effects. We can switch it to simvastatin. And again, as we go, we switch it to lower potent statins with lower side effect profile, or which better side effect profile. Again, this medication decreases your production of the bad cholesterol, and also in one way or the other also raises your good cholesterol, which is a HDL. And by doing this, it also decreases your risk of having heart attacks, stroke, and death as well. And then there's another medication called ezetimibe. It's known as Zedier. Zedier. It's a medication that has been added on, or we can add on to statins to help drive down your LDL cholesterol. It actually lowers your cholesterol by 20% when you add it on to statins, and it has a better side effect profile compared to statins. It causes muscle pain, but to lower incidence of muscle pain compared to statins. You can use it alone, or you can also use it in combination with statins. Mostly doctors here use it in combination with statins. Again, these are just the two ones we talk about here, but there are other medications that can also lower your LDL cholesterol. Um, yeah, again, yeah, so yeah, that's right. So again, it's also important to have, like, not just to discontinue by yourself, also to speak to your doctor before you self discontinue. Again, we don't recommend to self discontinue. Always speak to your doctor, your provider, before you stop. It's very highly important to highlight this as well. But again, we've known, studies have shown for a very long time there, this medication has actually driven down the risk of heart attacks, and people are now living way older with this medication. Also, there are patients who have a heart attack not amenable to intervention. They have them on aspirin and this medication, and their outcomes have been similar to those who had an intervention. When I mean intervention, like they had a cath, or they had a surgery, or something similar. Again, while the medication has some side effect profile, but we think the benefits far outweigh the risk, or outweigh the side effects that he has. And going down to answer the question that was popped in, Charmaine, I don't know if this is time to answer the question, but yes. So that's right, Gary Leonard. So that's 100% correct. So people do, again, we do have lots and lots of pushbacks from patients, for cholesterol medication. Again, I'm not in any way a sales rep of this medication. I'm only saying this because I've seen it work. And if I have high cholesterol, I'm gonna be on one without thinking about it, without giving a second thought. So So yes, it affects the muscle, but again, like we talked about earlier, if you have any muscle cramp, muscle pain, we can always switch it to the next, the next medication. And with switching it to another medication, I mean, same class of medication, but a different like a different type. So like a different type of the same class, right? So you can go from atorvastatin to rosuvastatin, and rosuvastatin have a better side effect profile compared to atorvastatin. So when you have the side effects and just you need to be on the medication, you speak to your doctor, they can switch you to another in a different type of the same class. Again, if that persists, um, you can also switch it to the next one. And if that also persists, there are lots and lots of there are other medications they can offer you. Ezetimibe is also another option they can have you on. There are other shots, like injections you can also be on that can help you, that can help drive down this cholesterol level. So again, muscle pain has been shown to be a side effect of the medication. However, we do believe like it's very few people, very few patients who are on this medication have it. But those who have it, there are options. Speak to your doctor about this, and they can for sure switch it to a lower a class that has better side effect profile. Yes. So, again, Charlene Locker does a very excellent question. I know this is like an area where there are lots and lots of research going on. There are studies, people have talked about. Well, there are a few studies that mentioned the link connection between statins and Alzheimer's. Well, again, the truth is, in the study that was done on the medication, didn't show and it didn't really show a relationship or a causation or association with Alzheimer's. But now there are newer studies that have been done. Again, the thing with these studies are these studies are actually what we call cross-sectional studies. We don't know if there have been any study that have followed those patients over time, like to see if they develop Alzheimer's. So more like a snapshot study linking Alzheimer's with use of statins. And then when we look at it, almost everyone above is 45, 50 are on statins. I mean, most people on statins. So again, it's an area of further research. What we do know, Alzheimer's can cause some maybe like acute, like I mean, like what we describe as like an acute onset memory loss, not like a long term memory loss, like a memory fog, like a very short term memory fog, like a very short memory fog, which eventually gets better. So, but truly Alzheimer's, we don't think so. We don't know because the studies that have been put out there were only cross-sectional studies, and there's really been no prospective studies that have been shown to link Alzheimer's with use of statins. Again, in the area of future research, people are like looking into the area to see if there are like links, associations between Alzheimer's and use of statin. But that's an excellent question. Good. So I guess just to put things together, how do we control our cholesterol? So first of all, cholesterol, we know is a fat-like substance that comes from two sources of food on your body. It normally mostly comes from animal sources, and it travels in your body via lipoprotein. So either the HDL, which is a high-density lipoprotein, which is a good cholesterol, or the bad lipoprotein, which is LDL. Again, high cholesterol can affect your heart, your brain, your artery, and all of these vital organs, your kidney as well. HDL is the good cholesterol, so HDL is a good cholesterol, while the LDL is a bad cholesterol. So always know that the HDL keeps LDL from sticking to your artery, and also it eventually reduces plaque burden or black plaque buildup in your blood vessel, and eventually, I mean, overall impacts your risk of heart disease and stroke. So track your level, check your level, get your doctor to check your cholesterol. Tell doctor, my LDL is high, is above 100. What do you recommend? Should I be on statins? Should I do other tests to make sure, like, my cholesterol is within normal limits? Eat smart. We talked about, the more colorful the more color you have on your plate, the better better it should be, or the more healthy it should be. Move more, 150 minutes of moderate intensity exercise. Know your fats. Don't smoke. Take your medications as directed. And at this point, I think I want to pivot to Dr. McCoy to speak more about what we have in our community.
All right. Thank you so much, Dr. B. That was an excellent presentation. So thank you for spending time with us tonight. And then just to go back to Charlene's question, because I wasn't sure if it was related to, do statins cause Alzheimer's or does it reduce Alzheimer's? So from putting my vascular hat on, I would say statins can help reduce it, because just like we get plaque in our heart arteries, we can also get plaque in the brain with the slowing down of blood flow. Then that also is what's leading to Alzheimer's and dementia. So it can potentially work because the statins work all over. All right, so this slide that's up, this is about community resources. So what we did is we looked at some of the clinics in the surrounding areas by counties. If anybody needs this assistance, the next slide that I'm going to show, please feel free to email me. So let me just go ahead and show the next one. Email, you can scan this QR code because our email address is pretty lengthy, or you can send us a text message to 571-377-8081 if you by chance need to get connected. When we think about resources, if you don't have a medical home, need a primary care provider, or just need some additional resources, we are definitely happy to assist. And then I see there is another question in the chat by so the question, some men refuse to take cholesterol medication in fear that it might be related to erectile dysfunction. Are there any relationships between the two?
Well, girl, that's also an excellent question. So far that I know, I haven't heard of any. So far, no, we haven't heard of any such link. Rather, it may even improve erectile dysfunction. Why? Because you're getting cholesterol. So the question of what causes erectile dysfunction, I'm gonna discuss it here, because you're having poor circulation to your penis. That's why you have erectile dysfunction, right? So if you're taking statins, which if you have cholesterol build up in your blood vessel to your private part, then taking statins can actually lower your LDL cholesterol, which can overall improve your flow, and then eventually improve erectile dysfunction. So no. Now there are some hypertension medications that can cause erectile dysfunction. Now, not to confuse yourself with those hypertension medications, because most times people who take hypertension medications mostly take statins, so they may confuse that together. But for the most part, we have not seen, we haven't had ever any link or any association between erectile dysfunction and use of statins. But that's a great question.
Excellent question. So this QR code up here is a post survey just to do an evaluation. We thank everyone that joined us tonight. And if there are any suggestions for our future webinars, we definitely would like to know. We can make adjustments to pivot, because like we said, we really want this to be something that is educational and provides information for the community. Our next webinar will be held on Tuesday, November the 18th. We will have a pharmacist, one of our own members from Mount Olive, giving the presentation. So looking forward to that, having some robust discussion, especially if you have some questions or concerns about medications you currently take, just some of the myths or things that we can help dispel. And as always, I thank everyone for their time. I'm looking in the chat. If there are no more questions, then everyone have a blessed and wonderful evening and week. And we hope to see you again next month.
Bye, guys.